Working through this latest COVID wave has been intense. So basically from Christmas break to now, we've seen a surge with our own staff testing positive with COVID, which is definitely scary.
I am home right now because I have caught COVID-19, the Omicron variant. I believe I caught COVID at my workplace. I actually might have to go into work earlier than expected because of the staff shortages. As long as I'm wearing my PPEs and I'm able to walk and stand and care for patients, I'll be asked to go in. And sometimes, that makes you feel kind of like a robot. That the fact that as a healthcare worker, you're going to have to sacrifice your health a little bit to go in and to maintain the healthcare system.
We are on the uptick and that the spread is starting. My biggest concern is that we have a small pool of highly skilled, good workers, particularly nurses. And right now, those staff are being stretched above and beyond, and I'm concerned about burnout.
My name is Katrina Studney, and I'm a nurse at SHN Centenary Site, which is located in Toronto in the GTA, and I work on the cardiac care ward.
My name is Naveed Hussain. I'm a nurse at the McGill University Health Center in the city of Montreal, Quebec, Canada. I work in the psychiatry ward, but I have cared for patients in COVID wards and in internal medicine.
My name is Inez Lewis. I work for the Chiam First Nation in Rosedale, BC, and I'm a registered nurse and health director.
This has been 2 years of this, and we really are at the brink. I already worked 7 12s in 2 weeks. I've added 2 to that, so I've been consistently working 9. I still go in additionally. I came in on Christmas Eve, even when I wanted to be with my family, just to help them out. It's had a huge impact on myself because I'm completely exhausted.
Because so many nurses are catching it, we end up working much harder, right? We're caring for more patients. What happens is our ability to give that care decreases. And that hurts. That hurts us professionally, and that hurts our ability to care for our patients. So, working those long hours and working short staff can be quite detrimental to our physical, our mental, and our spiritual psyche.
The hardest part about this wave is that we're seeing the impacts in community with mental health. We are really worried about the folks and what they need in order to continue on their healing journey. Isolation is really challenging. Some of the important services that we're seeing that we're having to shut down is that human connection that we all need. And particularly in the Indigenous community, the human connections of soft programming such as sports night, cultural nights, healing circles.
What I worry most about right now is my own family, because I have to risk bringing this home to my loved ones, including my elderly parents who are already immunocompromised, as well as my 5-year-old child. 2 years in, and I can't believe we've come basically full circle back to that original first wave and that original unknown.
What keeps me up at night right now is the fact that I feel people are not really understanding the fact that vaccines do work. Vaccines work because they allow symptoms to be mild and not major life-threatening conditions. So I've been vaccinated twice now, and I've caught Omicron, and it did not hit me as hard as it has hit the unvaccinated patients. People who are hospitalized, who might end up being on ventilators and intubated. It's so hard to see people suffering.
Funding for Indigenous healthcare, particularly nursing, has been chronically underfunded before the pandemic. So now that the pandemic is here, those resources are being stretched so far, as well as the staffing, that we've become to find ourselves at a breaking point. And so I think it's time that we put our heads together, particularly with the federal government, to look at these old funding models to see how can we better support services, how can we increase capacity in First Nations communities, and better support nursing to meet the health disparities that the folks are experiencing.
Emotionally, I'm completely exhausted, drained. There's days I leave work and I cry because I know that I haven't provided that care that is expected of not just me by my coworkers and everyone else, but by myself. Like, I feel like I've let myself down some days because I haven't been able to do that. And mentally, people don't realize that we have no visitors right now, like it's a really strict visitor policy. And I've actually held people's hands who had to die alone. That's something that will never leave me. That's something that mentally, I can't even explain to anybody. What I want people out there to know is we're still in this fight. I can tell you firsthand, the vaccine and everything, it works. So people get vaccinated. It's gonna help everyone. It's gonna help your neighbor, your family. It's gonna help nurses like me. It's gonna help the whole system.